My name is Dr. Mohit Chauhan, and I'm one of the adult psychiatrists. I mainly work with adult patients who have mental health problems, but I also have special interest in working with people who have dual diagnosis, which means folks who not only have mental health problems, but also have addiction problems. Addiction is a term that has been itself abused a lot. Nowadays, addiction is being used for anything that has been done for a long period of time, or too intensely, or for longer than one is expected to do it, or more than one is expected to do it. Nowadays, the term that we like to use more is chemical dependency. And we look at it as essentially a brain disease, a chronic, potentially relapsing illness. And what it means is that people who have been using chemicals, it has led to certain chemical and anatomical changes in their brains, because of which they find it very difficult to then say no to those chemicals, and they start affecting their life. Craving really is central to the idea of chemical dependence. In simple English, craving essentially means an intense, at times inappropriate, desire for something. But there have been various models to understand cravings for chemicals. Our brains are hardwired to crave for certain things which are essential for human existence, things like food and sex. But chemicals also affect the same circuits in the brain. So the hardwired circuits that make us crave for certain things that are essential for human survival, these circuits are getting affected by the chemicals and sort of getting on when they're not supposed to be on. And in fact, people can then start craving for these chemicals because of the same circuits. And that's how we kind of look at craving. Craving has been held responsible for most of the relapses in people with alcohol dependence. And there are essentially three parts to it as far as craving and alcohol dependence is concerned. The first part is when people have been drinking for long periods of time, the chemical balance in their brain gets affected. And when alcohol is taken out of that balance and the brain is not able to balance those chemicals themselves, it looks for alcohol to maintain that balance in the brain. So that's one part of it. The second part is really memory that the brain forms, that when people drink alcohol, it does have a pleasant effect. And that memory itself, when alcohol is not present or not available, can lead to cravings. And really the third part is, again, the brain recognizing that sometimes negative emotions can be dulled by using alcohol. These are the folks that we call are using alcohol for self-medications. But all it is essentially part of craving, just because of different reasons. Now, all these factors tend to work together in folks with chemical dependence issues. That's a really important question, and it's an area of active research. There are two facts that have led people to think that family history of alcohol dependence is important. One observation is that there are certain people in Asia who, when they drink even a small amount of alcohol, get physically sick. What is different in these people compared to other folks is that they are deficient in a certain liver enzyme, so they don't metabolize some of the end products of alcohol, which makes them physically sick. Now, what's interesting is that these people hardly ever get dependent on alcohol. So that's one part. The second part is that sons of alcohol-dependent males are almost 4 times more likely to become alcohol dependent. The observation with these kids is that they can tolerate higher amounts of alcohol without actually becoming, for lack of a better term, tipsy or having ataxia or imbalance. And because this runs in the family, that has led people to believe that genetics definitely plays some role in alcohol dependence. This is again an area of active research. There have been a couple of medications on the market for some time. There is a new one that was approved by FDA about 5 years ago. So because we have discussed that craving has different parts, I'll try and connect that to the anti-craving medications. So let's first look at the fact that part of craving is trying to recreate the balance in the brain that was affected by alcohol. And Camprol or acamprosate is one medication that tries to help the brain find that balance again and thus decrease the craving. The second is naltrexone, which is also called Revia. This medication decreases the reward that the person feels when they drink. So the pleasant effect that alcohol provides is decreased by naltrexone. So that's the second part. And the third part is a medication called Antabuse or disulfiram. This medication essentially does what the problem in some of those Asian males is, that it decreases the metabolism of alcohol, and people tend to get sick when they take this medication. And so it's sort of telling their brain that alcohol can be very unpleasant and creating that memory. So it's a big reason, other than sort of the fear of losing their job or getting into legal trouble, being physically sick with drinking. It can be a strong deterrent to drinking. So those are the three main medications. Looking at all three medications with acamprosate, one has to be careful that a person's kidneys are working fine before starting the medication. If someone is pregnant or is expecting to get pregnant, it's perhaps not the best medication to start because we are not sure about the safety of this medication. As far as common side effects with acamprosate are concerned, it's nausea and vomiting, sometimes diarrhea, headaches, muscle pain. And the serious side effects is that sometimes it can affect the heart and kidneys, so one has to watch for those side effects. But those serious side effects are rare. As far as the naltrexone is concerned, because it works, it's metabolized in the liver, so we have to make sure that the person's liver is working fine before prescribing it. Once again, the common side effects are constipation, upset stomach, sometimes nausea. One very important thing with naltrexone is the person should not be on any kinds of opioids because it can precipitate a severe withdrawal reaction. So one has to be very careful that they haven't taken any opioid pain medications before starting this medication. With disulfiram, person has to be very aware that they cannot drink with this medication. In fact, they cannot consume any kind of beverage that has alcohol in it because they can get really, really sick with it. Essentially, anyone who can tolerate these medications can be prescribed these medications. I have mentioned some of the things, like if a person has a kidney problem, they cannot take Camprol or acamprosate. If they have liver problems, they cannot take disulfiram or naltrexone. And if they're pregnant, essentially all these three medications are not known to be safe for children, so it's perhaps best to avoid them while you're pregnant or breastfeeding. That's again an excellent question. There are no magic bullets. They help with cravings, but the core of the treatment remains in getting counseling and attending self-help groups. So the spiritual help, psychotherapy, and medications in combination have been shown to work best than either alone. It is not very clear, mainly because no long-term studies have been completed. However, we know that cravings continue to be an important part as far as relapse on substances is concerned, at times for years. But currently, general practice is to at least continue the medications for 1 year. That's a good part with anti-craving medications that we have discussed today. As far as the alcohol anti-craving medications are concerned, they can be prescribed by primary care physicians. In fact, it is one of the things that we have tried to encourage because some patients, especially women patients, tend to go to their primary care physicians more than they go to substance abuse treatment or the psychiatrist. And primary care physicians really can play a very important role in prescribing and helping these patients.